And I want to welcome you all today to our April LA County Department of Health Services Patient and Family Partnership Hub meeting. Welcome, everybody. And like we said, some Zoom features. We have the chat is open and available. If you have any questions or comments to add during the discussion and you'd like to add it to the chat, you're more than welcome to do so. You can also private message someone by clicking where it says everyone and then clicking on the person's name. We do have live transcript available if you need it. There is the CC at the bottom of your screen, and you can click on live transcript. And then if you'd like to come off mute, you are more than welcome to ask a question or to join in the discussion. And you can do that by clicking the reactions button and then clicking raise hand to come off mute.
Oh.
And like I said, we are recording and live transcript is available. We also have a interpreter for if anybody needs it. Again, there's a globe on the bottom of your screen and you can click which language to choose. We just put the
Ven, te lo voy a amarrar para que no se te baje. Mira, ya se te bajó la blusa, Sol. Mira, cómo estás enseñando aquí todo. Tienes que ver. Espérate, déjate amarrar.
I think that is a side conversation. All right. Lindsay put the instructions into the chat for you to choose your language if you need it. Thank you, Lindsay. All right, and this is our agenda for today. We'll do some introductions and we'll talk about the open house, the patient community open house. And then we'll talk a little bit about who is hosting that open house and then have a discussion on what you would like to teach healthcare and what you would like to teach them and within that open house setting and with talking to other patient family partners like yourself. So I'll go ahead and pass it along to Mike.
Thank you, Laura. Good afternoon, everyone. Welcome again to our Patient Family Partnership Hub community conversation. Thank you so much for taking time of your day and joining us. Please know that we appreciate and value your time tremendously and that you are helping shape healthcare services for all of our LA County community. Again, welcome everyone. Bienvenidos a todos. In a minute, we'll do introductions. In addition, like Laura mentioned, in addition to our PFCC partners is Martin Conta from Green Translations, who will be helping us today by simultaneously translating our conversation in Spanish, and vice versa. We'll be helping our Spanish-speaking patient family advisors join in our conversation. My name is Miguel Renteria. I go by Mike. I'm an improvement advisor by DHS. My work evolves on patient experience, as well as supporting our culture of patient-family engagement across our health system. Our mission is to advance the health of our patients and our communities by providing extraordinary care. Our goals range from transforming our system to provide cost-effective care of the whole patient across the continuum, optimize clinical quality and patient experience, to have a high-performing workforce, and to ensure financial viability in support of our vision. Today, we're moving towards our mission by advancing on our strategic goal of providing high-quality care and patient experience through engaging your voice to help us in our work. Your voice, your views, your insights are incredibly important to our work, so thank you again for taking time off your day and joining us here this afternoon. Next slide. So I'll pass it over to Laura. So I'll pass it back over to Laura.
Thank you, Mike.
Thank you.
This is our mission, vision, and values for PFCC partners. PFCC partners with LA County Department of Health Services to to facilitate this hub for you all today. So our mission at PFCC Partners is to center the inclusive human experience of health, reinvent through radical collaboration, and be a catalyst for system transformation. Our vision is a health system transformed. We want one that works with people and through communities as a partner in their well-being. We do this through our values of equity, inclusion, diversity, collaboration, and being solution-focused. And this is kind of the hub structure. So within the Department of Health Services, there are 11 patient family advisory councils across DHS. And within those councils they're of course made up of patient family partners just like you. And then the hub kind of encompasses everybody that would like to be involved from within those patient family advisory councils, and any other patient family partners, that's patients, caregivers, family members that would like to participate in the hub. So we kind of encompass everyone, and that is including those within the patient family advisory councils. All right, let's do some introductions. Let us know your name, where you're calling in from, and do you consider yourself a morning person or a night person? So I can get started. My name is Laura Jackson. I'm the Director of Community with PFCC Partners. I am calling in from Eugene, Oregon. That's where my home base is, but our offices are down in Long Beach, California. And I think I'm more of a night person. I like to staying up late. I'll go ahead and pass it on to Ronald.
Hi, my name is Ronald. I live in Paramount, California, and I'm happy to be on this meeting today to learn, some of the stuff that you guys are going to be sharing with us. Some of the stuff I know that, there are things that we're going to be needing in the future days.
Absolutely. Thank you for joining us.
Yes.
And for our fun check-in question, are you a morning person or a night person?
Oh, I'm sorry.
That's okay.
I think I'm a all day person.
Nice. Thank you, Ronald. Ray.
Yes, good afternoon, everyone. My name is Ray Pizarro. I sit on the Patient Advisory Council at Rancho Los Amigos National Rehabilitation Hospital, located in Downey. I live in San Pedro, California, and I'm considered I guess a morning person. I get going around 7:30-ish every morning and start my day. So that's me.
Nice. Thank you, Ray. Thanks for joining us today. Maria.
Hola, buenas tardes. Sí, mi nombre es María Vázquez. Me considero una persona prácticamente por la mañana. Me gusta levantarme muy temprano y yo estoy llamando de acá del sur centro.
Thank you. Gracias for joining us today, Maria. Carlos.
Hi, my name's Carlos Benavides. I'm also from Rancho Los Amigos. I sit on the Patient Family Advisory Council there and chair LAC COD for the county on Commission on Disabilities. And I'm a night person.
Nice. Thank you, Carlos, for joining us today. Olivia. Olivia, you're muted if you're talking. Ah, all right. No worries. Thank you for joining us anyways, Olivia. Morning person. Nice. Thank you. Thank you. All right. From South Central. All right. Thank you. And Lindsay.
Yeah, hi everyone. I'm Lindsay Galley. I'm the Vice President of Programs at PFCC Partners. I'm actually calling in from Sacramento, California, a little up north. And I have turned into a morning person. I am up at almost 4:30 every morning to go to the gym. So I've kind of forced myself to be a morning person.
I would say so. Thank you. Thank you. And Mike?
Hi, good afternoon, everyone. My name is Mike Renteria. I'm here in the San Fernando Valley. And I am definitely a morning person. I wake up very early, usually around 5, even on the weekends, and just either do housework, wash cars, or catch up on anything else that is pending as well. So definitely morning.
Nice. Thank you, Mike. All right. I think I got everybody. Yep. Okay. Well, thank you all for joining in our call today. We'll go ahead and get right to it. So you all are invited to our patient community open house. It is May 1st from 2 to 4:30 at the California Endowment Center in Los Angeles. The address to that it's here on the screen. It's 1000 North Alameda Street. But we are holding this open house the day before our conference, which is on May 2nd. So that people like you all and like us, patient family partners, again, that means patients and their families and caregivers, can all connect with one another and learn about how you can make things better for the next person that needs healthcare. And so we will be there with information on our projects and information about the PFA network, which we will get to in a few moments. But you are more than welcome to join us anytime between 2 and 4:30. It's not going to be like one long meeting from 2 to 4:30. You can come and go as you would like. But we want you all to just connect with one another in person if you can. Join us and connect with other patient family partners from across the US will be there as well. So you can join to learn about what others are doing and what we're doing in the PFA network. So I did want to start off if anybody had any wondering if anybody had any questions about the open house, logistics wise, or content wise as well.
Disculpe, creo que no tengo la pregunta acerca de eso, pero solo le quería preguntar, ¿aquí podemos nosotros llevar a otras personas que estén interesadas en aprender?
Thank you, Maria. Did we have translation? Sorry.
Oh yeah, there was. Maria asked if it was open to anybody else who was interested in learning.
Thank you. Am I in the wrong room again?
Oh, Laura, can you hear me?
Yes.
Okay.
I think I was in the wrong room. I'm so sorry.
Yeah. Yeah, Maria was just asking if they could bring anybody else with them who was interested in learning, and I'll start and just say absolutely 100% yes. The more the merrier. Please bring friends, families. or family members, anybody who is just interested in learning more and meeting other members of your own community. We're excited that we're going to be in Los Angeles. So, we really want to have a big showing of the Los Angeles County community, patients, families, whoever you might be. So yes, please bring whoever you would like.
Thank you, Lindsay. And we will have an interpreter present as well. So live interpreter there at the event. So if you need someone to help translate, they'll be there for you. Carlos, I saw you come off mute. Did you have a question?
Yeah. No, I was just gonna say, if you needed somebody to tell her in Spanish, I could tell her real fast. But if you got it, it's fine.
We got it. That was on me. I was in the wrong in the wrong room, in the wrong interpretation.
Okay, no problem.
Thank you, Carlos. All right, so the open house will be held, it is hosted by the PFA network, and we wanted to kind of introduce you all and learn about what the PFA network is. Some of you may have heard of it, some may not have, but it's a national network of patient-family partners seeking to reinvent healthcare by harnessing their shared experiences as patient-family advisors. And actually the term patient-family advisor, we've kind of started using patient-family partners. It seems a little bit more accurate with the patients and families partnering with their health systems to make decisions and make changes within their healthcare setting. So, and actually speaking of what patient and family partners are, or patient-family advisors, they are people who are using their lived experience to improve healthcare together. So it's people, again, just like you all, sharing your stories, sharing your lived experiences so that we can improve healthcare and partner with those healthcare organizations. So this is a picture from, actually, it's kind of funny. It's from January of 2020, but it feels like it was 10 years ago. These are patient-family partners from across the US. We came to a one-day meeting in Washington, DC, and you may see some of these faces at the open house as well. So that is who is putting it on, and those were patient-family. That's what we mean by patient-family partner or patient-family advisor. So to kind of explain the PFA network and what we do, so we kind of start off with healthcare as a whole. We know that the US healthcare is very complex, and it includes a lot of people. We've got healthcare organizations, research organizations, and clinics and hospitals, and there's just so much that goes into healthcare, as we all know. And PFCC partners and PFA network, we believe that that a system that centers care and care processes on the actual patients, the humans, has the potential to reduce complexity and bring in
Why?
culturally humble and equitable healthcare system. All that being said, it is kind of, healthcare, as we know, is kind of a big tangle, as we can see here. And again, we at PFCC Partners recognize the need to open spaces for patient family partners to come in and tell their voice, or come in and use their voice and tell their stories and share their lived experiences. And we know that the voices of patient family partners are a huge catalyst for improvement and change. So we have opened these spaces for patient family partners to then fill those, there we go, fill those spaces with the PFA network. So the network, again, is a community of patient family partners that are using their lived experiences to fill in those gaps within healthcare and influence healthcare improvement. I know that was a lot, but that is who is hosting the open house for you all. So there will be PFA network members from all across the US there who are attending our conference and attending the open house. And so it's just a network by advisors or patient family partners for patient family partners. I'll go ahead and stop there if we have any questions. Right. No questions. So a little bit more about the network itself. We have kind of what we call 3 buckets within the network. We have engagement opportunities where members can connect to the growing number of projects. So we have people come to us looking for the patient voice in panels or focus groups. Last month, we talked about the Equip LA focus groups. We had Elizabeth join us and talk about her experience. That was an engagement opportunity that she got connected to participate in those focus groups. We have an online community. We have a forum, just like we have a forum here for the LA County Department of Health Services Hub. We have one for the PFA network as well. And that's where patient family partners can connect with one another kind of outside of the meetings and share resources, ask questions, things like that. And then we also have skills development, which the last one was measurement basics, and then we had one before that, which was core competencies, which you all were invited to that as well. I think some of you joined us to learn about the core competencies of patient family partners. So we facilitate these skills development or skills exchanges for patient family partners to hone in their skills within their work with healthcare. So that is who is hosting the open house on May 1st. So those are some of the things that you might hear when you are at the open house on May 1st. You might hear things like engagement opportunities or skills development or hub. We have 3 hubs. This one included the LA County Department of Health Services. We also have 2 other hubs that kind of correlate with a couple other projects that we're doing, that the people that are involved in those, it's also kind of location based on where they're located so that they can kind of connect on what's going on in their healthcare settings a little bit more locally. So that is what will be at the open house. And speaking of that, I'm going to go ahead and pass it over to Lindsay for our discussion on what you all would like to teach healthcare.
Yeah, thanks so much, Laura. And again, thank you everyone for being here with us today and learning a little bit more about the open house next week. hopefully we get to see some of you there. I am super excited just to kind of mingle and learn with all of you. So what we wanted to do just in preparation for that session or the open house next week was kind of come together for a common message that you all would like to bring to the open house. And for those of you attending the conference the next day, just so you can all be on the same page and feel really supported by one another and other patient family advisors that will be there. So what I'm going to ask, and I have a few examples on the screen, if you could chat in what you want to teach healthcare. There may be a lot that you want to teach healthcare. They may be similar to what you see on the screen here. So be my partner in healthcare. Treat me with compassion and respect. Speak to the strengths you see in me. And a big one that we always say is that patients and their families, family caregivers are the most underutilized resource in the environment in healthcare. So thinking about your own personal experiences, please chat in as much as you would like in the chat box, what you would like to teach healthcare. And I'll give everyone just a couple of minutes to do that. And I'm going to be capturing them all. And if you're unable to chat in, please feel free to come off mute and speak up, and I can capture those too. I think a big one that we hear a lot is to listen to me and my family, and what's most important to us as patients. That's a big one that we hear. But please share any others in the chat or come off mute. Does everyone need just a minute to marinate? I guess that's kind of a big question. What do you want to teach healthcare? All right. First one from Ray. Disability etiquette and sensitivity training. Great. Thank you, Ray. What else? Quiet group today.
I was just thinking kind of on the last one, kind of have to do with that one, that caregivers specifically can be really big help with if there's an inpatient, caregivers can be a really big resource for the providers.
I like that. Yeah. Sometimes the caregivers are forgotten. And, I think one of the big things about being a patient family partner, a patient family advisor is that, we don't have to have all the answers but what we do have is our own experiences in healthcare, and that's exactly what you need to be an effective patient family advisor. So I just encourage you all to kind of think about your own lived experiences, and based on that, what is something that you wish you could go back and say, hey, this small change would really make a big difference to patients and their family caregivers. Right. That's, oh, and that, is that Ray or Carlos? I can't tell. It might be Carlos. Carlos picture, yeah. So Carlos, the importance of transparency and better explanations to make caregivers and patients understand how to navigate their health. Yes, I think transparency is a huge one that we hear a lot. And to live a better quality of life, definitely. How about Ronald, is there anything that you'd like to teach healthcare?
See, well, I'm a patient. I'm sorry, I'm not what you call it? My wife is the one that takes care of me,
Mm-hmm.
Yeah.
Yeah, absolutely. And that's what I was kind of referring to is, that's all you need. So, based on, being a patient and what you've experienced, is there anything that, you wish you could tell your doctor, your healthcare provider that would help improve your experience, or, just anything in general that you wish you could tell them?
Yeah, well, we don't, the good thing about right now is that, that I'm sorry, but getting in touch with either my pharmacy or my doctors, I could always log into that Health Partners app that I have, where, where if I have a question, then, I would just go directly to my doctor's nurse, and she will relay my message to the doctor, and within 24 hours, I will have a response.
That's amazing.
Yes.
That sounds like it works really well. So, I hear other people's experiences that they don't have that same ability to, message their doctor or be able to have their doctor work with pharmacy or other nurses. So what I added was, collaborate or like work together with others to make sure that you have the best health outcomes. And it sounds like technology has really helped you do that, being able to send messages to your doctor and nurses, and being able to hear back really quickly. Sounds like it's something that works for you. So I think, looking at not only the maybe not so good experiences that some patients have, but the good, really good things that are going on, like it is for you, and being able to spread that to other health systems and talk with other patients about, what works really well for you that maybe they could change in their health systems. But
Yeah, I'm sorry. When I go to, because I go, the hospital I go to is Rancho Los Amigos, which, I consider one of the best,
Yeah.
But but if I happen to have like a doctor's appointment and I have to be there in person, and I hear someone, struggling, how to get in or to get into some other department, whatever I learned, like for me guys, whatever I learned, that's what I share with them, to make it easier.
Mhm.
Yes.
Great. I'm gonna add that, make it easier. I like that. Thank you, Ronald.
Sure, no problem.
And Michelle, I see your chat about classes that are considered healthcare. Can you tell me more about that? Or what you were thinking there? And teach might be a strong word, and maybe it's just, what do you want to tell healthcare about how it can be improved for others? All right, what about Maria? Anything that you want to tell healthcare? Oh, and you're putting it in the chat. Thank you. Martin, can you please translate that, the chat?
Absolutely. It says in terms of my son, they are connected to the doctor and to the therapist.
That's amazing. And sorry, Martin, can you please translate the last comment from Maria?
For sure. Yeah, that's been providing good results.
Okay, great. That is so important, Maria, the connectedness. I'm glad to hear that that works. And so I'm so glad to hear, some of the things that are going on that are working really well, where you're getting good results, having good health outcomes, because that is something that we can spread and share with others also. So thank you. Great. Ray, I like that one. Build another rehab center, excuse me, to help improve wait times. All right, any others? I don't think we heard from Olivia. Olivia, do you have anything to add?
And Maria in the chat says, unfortunately, there isn't much of these rehab centers in many places.
Mm-hmm. Yeah, great point, Maria. And Rancho is a great one. I know there's a few of you on who are all at Rancho. And Carlos, that's one that we hear a lot, that to remember that, patients are people and not just another number. Great. All right, well, thank you, everyone. So Laura, can I share my screen really quick?
Yep, if I can figure it. There you go.
Or I guess you could have shared it too, but I'll go ahead and share. So I was capturing everything that you were sharing here. And we do this with larger groups. And so what we tend to see is that the responses, there tends to be themes in the responses. So for, let's see, this one, it was, working together with other specialties, pharmacy, things like that, and using technology. We also have, being connected for really good results. That all kind of falls under collaboration. So I'm just going to make a little sticky for, collaboration. So one of the themes that it sounds like you all want to get across is, you want healthcare to collaborate not only with other people, the nurses, pharmacy, things like that, but with you as a patient. And I think that's so important. Also, caregivers being able to collaborate as well. So putting it in that bucket. I think, another theme that I'm seeing, and it kind of comes with all of these, having some sensitivity training, transparency, listening, I think making it easier kind of falls in between. But what I'm seeing here is communication. We want improved communication. We want to bring that message to healthcare that communication is really important to us. So let's work together with our partners in healthcare, like Miguel, who is here, and all of the wonderful workforce at DHS, to learn how we can improve communication together. So we start to see these themes, so we can take these themes of collaboration and communication and come together to that open house or the conference and really have a shared message together and be able to connect with one another and connect with other patient family advisors and partners on this kind of shared description of what we want to teach healthcare. I did want to show, just so you can see what this looks like when we have a really big group doing it. So we, again, and this is from training that we did earlier this year, and you can see, there's some common themes and messages with communication, collaboration. Respect is always the big one that we see. And this was put together by members of the PFA network that Laura described. So you have this shared common theme and passion about what you want to teach healthcare. So I shared this in, letting you know that you are supported by a whole lot of people who believe in the exact same things that you do, as far as, what you want to see improved in healthcare. And Olivia, I see your message in the chat. Martin, can you, two of them. May you please translate those?
Absolutely. Pulling up the chat. Olivia says, well, maybe also adding a promotion in order to facilitate information or a way to sign up for any type of program regarding community healthcare. Mostly for the adults whom technology maybe is not that easy. There being that there are places where you need to, or they require for you to sign up over the internet, and it kind of makes it hard for them.
Oh, wow. That's a really great point, Olivia. And I think that kind of goes along with this theme. I'm going to put it right in the center, make it orange, of make it easier. Make it easier for people, no matter what their experience is with technology, their knowledge, their background, their ethnicity, whatever it might be, being able to have space within the community and within the health system to make it easy for people to get the care that they need. That's a great addition. Thank you so much for sharing. All right, well, I think we can share this out in follow-up so you can, take it with you to the open house as kind of a reminder of what we all want to teach healthcare together. But I really appreciate everyone sharing their thoughts and ideas. And I am really looking forward to actually seeing people in person I can't wait to get out of here and see
Excuse
you
me,
all.
can I just add just the
Yeah.
last one?
Mhm.
You know, the way they have it, the way they have, when you have a, sorry, when you have an appointment at Rancho Los Amigos at the lab, you don't go directly to the lab office. Before you go to the lab, there's like a waiting room, and there's like a machine where you click what you're there for. You get a number, and you know, if you're there like to get your blood withdrawal, you know, or for some other things, then you just, you know, click it on the computer that they have or the screen, and then they give you a number, and then you just wait, sit down and wait, and they will call your number and tell you what window to go to. You know, that's what I was referring as making it easier. You know, if you go to the other departments like Clinic 1, Clinic 2, Clinic 3, if you go there and you have a doctor's appointment and you scan your medical record, you know, they will ask you. It'll be nice if they will ask you the same way they do it at the lab.
Mhm. Thank you for bringing that up, Ronald. And I know exactly what you're describing too. It's I think they called it a queuing system to help make it easier for people to get to wherever they need to be. And actually the team that worked on that came to a meeting just like this, the Patient Family Partnership Hub, and asked patient family partners and advisors and just the community what they thought and how that could be used really effectively. So I'm glad to hear that it's working. Joe, that's awesome. Thank you for sharing that. All right, Laura, I know we have a few minutes left, so I'll pass it back to you to wrap us up. But thanks again, everyone. Great ideas, great conversation.
Yes, thank you. Thank you, Lindsay. Thank you, everybody. All right. So again, we just want to invite you all to the Patient Community Open House. You did receive this flyer along with the Spanish version in your inboxes for the invite for today. We will be sure to send it out to you all one more time so you get it with all the information, and there's the QR code here that you can scan with your phone just to get a little bit more information, or just to have the information on your phone. And again, you are all welcome to join us anytime between 2 and 4:30 next Monday, exactly a week from right now.
Yeah, and bring your friends and family.
Yes, yes. Bring your friends, family. We do have an interpreter that will be there live, so he can help you and help us interpret as needed. And that open house is the day before our conference. So our big PFCC conference is also at the California Endowment Center. I think some of you may be planning on joining us. And we are just really excited to see everyone at the conference and the open house. And then our next Partnership Hub community conversation will be next month, May 22nd, same time, 3:30, same link. So feel free to join us next month, and hopefully we'll see you all on Monday. Thank you,
Hi,
everybody.
very good. Yeah, that's fantastic.
Thanks, everyone.